Well, we know that some people are leery of a COVID vaccine produced quickly. Russia became the first country to approve a coronavirus vaccine, administering it to tens of thousands of citizens prior to completing the final trials. While it may be the first one in the world, it brings to the forefront questions about any vaccine that's developed on a fast track, developed so quickly. Joining us now to answer some of our questions is Dr. Jen Caudle. Thanks so much for joining us, Dr. Jen. We all, heard the news yesterday, and I think it was alarming for a lot of people because it was so quick, and there didn't seem to be a whole lot of science to back it up. The World Health Organization saying that all vaccine candidates, they should go through full stages of testing before they actually roll this out. And now we're hearing even today that they plan to roll this out to thousands of people that have never even undergone it. So what's your take?
Yeah, so I think that was a really great assessment. I think, one of my biggest concerns and the concerns of many health care officials out here is that there's just not a lot of data that we are able to see. Number one, it seems as though we don't have a lot of data on what has been done in terms of this vaccine, the trials it's undergone, the preclinical data, et cetera. That's the first thing, is we don't have a lot of that data. And the second issue, as you mentioned, is that, reportedly this vaccine has not undergone phase 3 clinical trials. That is very, very important. And as we know in this country, we have a number of vaccine candidates that are in the process of being evaluated. We have a couple of that are going into phase 3 trials, just so people out there understand what the phase 3 of the clinical trials are. There's certain preclinical stuff and phase 1, phase 2, phase 3. Phase 3 is where hundreds to thousands of volunteers are tested with the vaccine. So it's a large number of people, which is very important. But that's often when we get a lot of our safety and effectiveness data from, and we also can identify common side effects. It's a very, very important stage of trials. And without a vaccine having gone through that, it really does raise a lot of questions. So I have to tell you, I was shocked too, just like the rest of the world, when I saw that they had registered a vaccine. But it is, I think, concerning that we don't have a lot of data.
Not only that, I'm not a scientist. I'm not a doctor by any means. But what stood out to me is not only did they make this announcement, then Putin came out and he made claims that this thing has long-lasting immunity. I mean, is it even possible to know at this point, just considering how quickly this came about?
Well, I think what's fair to say is we don't know what we do know, and we don't know what we don't know, because there hasn't been much data released at all about this vaccine. There's just a lot we don't know. And certainly he's made these claims and has said other things, that his family was inoculated with the vaccine. He had some family members, et cetera. But the point is, we don't know. And again, that's a concern. It is very important that vaccines undergo the proper rigor. And that's what we are doing in this country, at least with FDA approval. Vaccines have to go through these different phases. We want them to. We want to know that a vaccine is safe and effective and tried and true. That is important.
And so that leads me to my next question. So by releasing a vaccine that isn't safe, or releasing one that in the end does not work, what kind of damage does this do?
Well, once again, my issue with the Russian vaccine is we don't know what it does and what it doesn't do. I can't say that it doesn't work. I can't say that it's not effective, but I can't say much because, again, the data has not been released, and apparently it has not gone through phase 3 clinical trials. But what I can say is we do want a vaccine candidate that's gone through all of those trials. We do want a vaccine candidate that we have all of that data on, and that we can go back and say, okay, we've done the proper steps, gone through the proper channels, and we can say that we think this is relatively safe and effective for the people of our country. That's what we want to do. Mm-hmm.
Yeah, and you talked a little bit about the trials that are underway here in the U.S., entering phase 3. Say once one of these is approved, is this going to be a situation where just anybody can walk into the doctor's office and say, hey, I want to get the vaccine?
So, that's an interesting question. The answer is I'm not quite sure yet. This is something I've done a lot of thinking about with my colleagues. Obviously, the goal is to make it available to all people. That's what we need. But there is talk among the healthcare administration, et cetera, about how the vaccine is going to be rolled out and to whom first. It's not likely that we will have enough of the vaccine available to give to everybody all at once right in the beginning. So some people will be prioritized. How they are prioritized is the other question. Is it going to be healthcare workers? Is it going to be essential workers, et cetera, high-risk people? So that's a question that I think is still remaining. And then the second question, one of the next questions is, then how do people get it? Do they just walk into their doctor's office and get it? These are questions that we have that remain to be answered. What I'm hoping for is that we have a seamless process, whatever that is, and that we prepare well enough in advance so that when we have a vaccine, it doesn't become like the test, the COVID test that honestly we are still struggling with. I hope that this is rolled out in a seamless fashion and that people are actually able to get vaccinated. That's what my hope is.
All right, Dr. Jen Caudle, making it all make sense. Thanks so much for joining us early. And of course, you can always follow Dr. Jen at drjencaudle.com or on social media. Thanks so much.